So today I wanted to talk about some frequently asked questions about Botox. So the most frequently asked question I get is, how does Botox work? Botox is a neurotoxin, and basically what that means is that in the area where it's injected, it causes that muscle to relax. It doesn't mean the muscle gets paralyzed, it simply means that that muscle becomes less strong, and whenever it contracts, it does so with less force. And therefore, that muscle has reduced activity. So over time, that allows for less wrinkles and less pain. That leads me to the next question, which I get asked all the time, and that is, am I a good candidate for Botox? So in order for you to be a good candidate for Botox, the thing that I see most frequently in the dental practice are people who come in with jaw pain or pain in their temples. You would know if you're one of these patients because you commonly wake up with pain in these areas, or you may also have pain in these areas during the day if you're somebody who's clenching or bruxing, daytime or nighttime. The other areas that we see in the dental world are for people who have lips that are hypermobile. And what that means is that when you smile, if you show a lot of gum tissue, you may want this to be a little less, so you show more teeth and less gum. As a result, we can place a little bit of Botox in this area, and that tends to give you great results and a better smile. In addition to that, we also do Botox for areas that are more cosmetic, and those are for the forehead, the crow's feet, and dimples in the chin. These are all areas that are up to your discretion, and if there's something that you're aesthetically concerned with, come in for a consult and we can discuss further if this is right for you. People often ask too, what age can I start getting Botox? So it's never too late to get started. What I would say is people usually come in around their 20s, but I've treated patients up until about 78 years old, so it's never too late to invest in yourself. How do you know if you're not a good candidate for Botox? So if you have an extensive medical history, if you're on any blood thinners, or if you're pregnant, you might want to wait to get Botox or maybe get a medical clearance. During that first appointment where we have the consult, that takes roughly 10 to 15 minutes, and we assess how much Botox you're going to need. If you have stronger muscle contractions or deeper lines, it's usually going to be a little bit more units that you might need. If the lines are fine, or if the muscles aren't as strong, you may need less units. And this is all decided upon in that initial consult appointment, and that's usually about 10 to 15 minutes long. After that, we can go straight into administering the Botox, or we can schedule that for another time. And that appointment takes roughly another 15 to 20 minutes. So if you do the consult and the administration within the same day, you can be in and out within about 45 minutes. So the next question people often ask is, what does that appointment look like? So one of the first things that you need to know is, A, it's not going to hurt. The needles that we use for Botox are really small, and the actual needle is really tiny, so people tend to have very little pain, if none at all. In addition, we use a lot of numbing gels and creams, so if that helps, that'll definitely make sure that you feel the least amount of pain possible. For the actual appointment, you will have small little injections in the specific areas where necessary, and we will map those out on your face, and we will then administer the right amount of Botox to the specific areas. Right after the appointment, you may notice a small bumped raised lesion right where the injections were. That is really tiny, and it usually goes away within half an hour. Usually people can go right back to work without any evidence that they had Botox done. This tends to be more frequent on the forehead area and for people who have sensitive skin. Often people don't have any lesions at all, but just so you know what to expect. Now, usually after that first appointment, we have a second appointment booked in about 14 days. People often ask, how long is it going to take for the Botox to set in? And it depends for everyone. What I would say is, on average, about 10 to 14 days is how long it takes for you to start seeing results. After the Botox has been administered, the next thing people ask is, what are the side effects going to be, and how long is it going to take for me to see results? So right after we give the injection, you might see a little bit of a red bump on your forehead area, but that only lasts about half an hour at most. Usually people can go right back to work. Now keep in mind, that doesn't happen for everyone. It usually happens for people with a little bit more sensitive skin, or specifically in areas where the skin is a little thinner. It often doesn't happen at all in areas of the jaw muscles and the temporalis muscles. Now, the next thing you also want to keep in mind is it's not going to take effect for about 10 to 14 days. So don't love it or hate it for a little while. Give it time to settle in. Usually, after 14 days, we set up a second appointment. At that appointment, we're going to evaluate the areas and see if there are any enhancements needed. Most of the time, the amount of Botox we've administered from the get-go is usually good, but if you need a little bit more, that's when we can tweak it. How long do the results last? So, on average, they last anywhere from 3 to 6 months. In the beginning, when you get Botox, it usually lasts a little bit less, around 3 months range. And that's because it's the first time you're using it, and the muscles tend to be a little stronger in that time. After you've been using it on an ongoing basis, the muscles tend to relax more, and the interval with which you need the next shot is usually less. So over time, you usually need less Botox, not more. The other thing people want to know is what do you do when you go home after that first appointment? So a couple things you want to keep in mind. Because you've had those injections and they're fresh, you want to make sure that they stay in the places where we've given them. Usually what that means is maybe avoiding some cardiovascular activity that day. Facial or a massage is probably not a good idea, and try to sleep on your back. Other than that, you should be good. Once you've been using Botox on a regular basis, you will find that the results last longer and you will need it less and less as time goes on. Come on in and see if you're a good candidate for Botox, and I hope the information we gave you today helps you decide if you want to come in and get a consult. At Bogota Dental Center, we love to see you smile.